Hi there, I'm Dr. Mahesh Mohan, a quadruple board-certified non-surgical orthopedics, pain medicine, and regenerative medicine specialist practicing in Frisco, Texas. Welcome to Pain Specialist of Frisco.
Should you get an epidural steroid injection? Are there other options? Pinched nerves and bulging spinal discs can cause debilitating pain, but they can also create serious structural problems in the body by weakening important core stability muscles around the spine and other muscles that may cause your body to move incorrectly. When this happens, a bulging disc in your neck may cause tendinitis in the elbow, or a pinched nerve in your back may lead to hip, knee, or ankle problems. It's easy to see why so many people require treatment for disc-related problems, but research now shows that the most common treatments are causing serious long-term complications. Today's surgical solutions involve cutting away the bulging portion of a spinal disc, but this rarely helps patients and may set them up for more severe disc problems in the future. To understand why, think of your disc as a bicycle tire and tube. Cutting out a bulging disc is like sanding down a bump on the tire, caused by a weak sidewall. It reduces the size of the bulge, but the tire becomes more likely to fail, just like surgically removing a disc bulge makes the disc more likely to fail. In the 1980s, doctors began injecting high-dose steroids into the spine in a non-surgical procedure known as an epidural steroid injection. It seemed like a good idea at the time, but it is now known to produce serious side effects. You see, if the height of a matchbook represents the amount of steroid your body naturally uses to control inflammation, the amount of steroids in an epidural injection would be the height of the Empire State Building. In a recent study of middle-aged and older women, the high-dose steroids used in a single epidural shot hurt their bone density and increased their fracture risk by 29%. In another study, a short course of oral steroids increased the risk of a severe bone disease by about 400%, and a staggering 21,000% after being on these drugs for a year. Here's the good news. Regenexx PL Disc and Regenexx DDD are non-surgical procedures that utilize the natural growth factors from your own blood platelets to reduce inflammation and help heal injuries. These growth factors are like espresso shots for local repair cells, making the cells work harder to help heal the damaged tissue, and the results speak for themselves. In our registry-based study, patients reported much better function at 3 and 6 months following the PL disc procedure than those who had steroid shots. So before you let someone inject that Empire State Building of steroids into your spine, or sand down that bulging bike tire, consider the benefits of these next-generation Regenexx disc procedures, and let your own growth factors put you back on the course to an active and pain-free lifestyle.
We specialize in comprehensive, advanced treatment options for your spine and joint conditions. By working with you, we are able to identify the root cause of your problem and work on fixing it.